Hi, this is Dr. Robert Davidson. I'm Program Director for the Nutrition and Human Performance Master's Program at Graceland University. I want to just take 1 minute, tell you one of the reasons I think this is such a great program and uh, why I think maybe people might be interested in coming to Graceland or doing our online program rather than someone else's online program. And today, what I want to really get into is if you think about how other programs and how the medical community, especially, talk about obesity and teaching about obesity, energy balance is everything. It's the cause of obesity, according to them. And really, when you get into it, it's an individual's behavior. It's that individual's fault that they're obese because they're overeating or they're not exercising enough. And really, when you get into uh, obesity and fat accumulation, there is so much more to it. In our uh, clinical nutrition, obesity and metabolic syndrome course, we talk about over 20 different causes and contributors to fat accumulation. Yes, gluttony and sloth, over consuming or lack of physical exercise are two possible causes of fat accumulation, but they're not the only one, and they're not the cause every time. When you look at hormones, there's 7 different hormones we talk about in class that have a huge effect on metabolism and fat accumulation and fat mobilization. And so just how these hormones work normally, and if there's a misregulation or something going wrong with the way they're working, it can have profound effects on our fat storage and fat accumulation. Diet composition plays a huge role, just as energy balance tells us when an individual is going to gain or lose weight. Diet composition uh, tells us, what the composition of the diet is, will tell us what the composition of that weight change will be. We've known for a long time that if you want to minimize lean mass loss, retain all the lean mass you can and lose predominantly fat or all completely fat. If you go on a diet or some type of intervention, then either weight bearing exercise or decreasing carb intake and increasing protein intake will have a huge effect on that. And we talk about that. We actually get into some computer simulations in the course on that. Food consumption, food timing, and can play a huge role. If we're always consuming carbohydrate or always snacking, then we've always got an insulin response, and that insulin blocks the action of hormone sensitive lipase in the fat cell so that the triglycerides, the fat doesn't break down and allow that fatty acid to get back in the bloodstream for energy use by the muscle. And so uh, diet timing, food timing can have a huge effect. Viruses, we know there are several adenoviruses that cause obesity in animals, and there's one adenovirus under a lot of scrutiny right now when it comes to obesity in humans as well. Environmental exposures, there's quite a few different chemicals we can be exposed to in the environment that can cause fat accumulation. Sleep deprivation or social jet lag, partying on the weekend, staying up late, anything that disrupts our circadian rhythm can have a huge effect on our normal metabolism, usually by altering one of the hormones that we talked about a little earlier. But anyway, we do know that just by watching what we're doing as far as getting enough sleep can have a profound effect on fat accumulation or not accumulating fat. Pharmaceuticals, we're going to talk about probably over 15 or 20 different pharmaceutical compounds, different drugs that doctors prescribe that have a huge effect on fat accumulation and disrupting some of the hormones that we talked about earlier. Fructose is a sugar that does not come under our normal hormone control and regulation in the body. And we talk about how fructose and some of its downstream metabolites can lead to fat accumulation and inflammation as well. Fetal programming starts getting into some of the nutrigenetics, nutrigenomics ideas. We know that fetuses that are deprived of magnesium, an essential mineral, um, have, at least in animal models like rats that we study, have over 100% have 100% diabetes rates. And in the second generation, even if they're have full access to magnesium, even down into the second generation, they still have 50% diabetes rates and more fat accumulation than they would be expected to do. So anyway, um, just an idea of or maybe a reason to come check out our program and come get some more information and see what we're all about. Thank you.